Yeah, the Edwards Francis Small Teaching Hospital Pediatric Ward that actually was born few hours ago. According to the information that we gathered, fire just started from one mattress that was not actually occupied by any patient. Is the cause of the whole fire. And then what we understand, like we said, according to them, the belief is caused by electrical shock. So we have the public relation officer, principal public relation officer.
Will reveal as to how did that fire started.
Moving forward, what step is the administration going to take in making sure such incidents do not occur, especially in a very sensitive ward?
We've always been very watchful. We've been always on the alert. We go around morning and evening, go see what is the possible cause of whatever could be a possible cause for anything here. So we are always on the alert and we're ready. We know that this is an incident that happened, but this is not often happening here. So accidents can happen, and so it happened. We accepted it.
So we understand a lot of electrical appliances have been burned. Could it be a reason that the fire was actually sparked from an electrical failure?
It could be that, but that would be speculations, and I don't want to go into speculations. We want the investigations to get completed so that we have a full picture of what transpired.
Once the administration get a full picture, what measures are you going to put in place to making sure such an incident will?
If we know the causes, we try to do the best we can to avoid such kind of an incident happening again.
Of course.
So long as we don't know yet what caused the fire, we wouldn't be able to know what precautions measures we need to take.
Of course, we know that information must have already reached out, especially to some of the patients who were here.
Right.
What message would you have for those who are out there?
I want them to understand that this fire happened, but there are no casualties here. So they don't need to be worried. They don't need to be worried that this is an accident, but we took care of it carefully, and we did the best we can by evacuating the patients and making sure that nobody gets hurt.
Any other thing you want to add?
I would just want to say that we would have to wait until the investigations are done, then we can come back to you and say as to what happened.
We've just had it, and the hospital actually management would take in. You could see we're going down to where the fire actually was expected to have started. So this is one of the offices. You could see what happens, and then we will take you around, and you could see this whole place.
This is the conference area,
well,
and this is where we believe that the fire actually started from here. As you can see, it's still smoldering.
Yeah.
There's still some little smoke coming up to that. And it has come all the way here, as you can see. These are all these affected areas. A lot of damage has been done. Yeah. It's a material lost.
Well, we've actually discovered a phone.
Yes.
This is a cell phone that has been charging here.
Yeah.
And could it be a reason why this whole spark started? And what safety measures will the hospital taking moving forward on this particular incident?
As I said, we need to know the cause of the fire so that we'll be able to establish what kind of precautions we need to take in order to avoid such things from happening again. But again, we have to wait. We have to wait for the full investigations to be done.
Are you not privy to the preliminary investigations on?
No, it's going on as I'm speaking to you. They started this morning, and we are still investigating. Fire services were here, and they put the fire off, and they're looking into what really might have caused this. We don't know yet.
This must have been a lot of damages too.
There's a lot of damage done, material damage. Thank God there are no human casualties here. But yes, we lost some equipment here, As you can see, this window had to be broken so that water can be pumped.
Of course,
into
we
this
know
pipe.
it's an election year and a lot of misinformation, is on high gears. What's your message or reaction to that, given the fact that some people will use this as an incident or as a springboard to spread?
People will always use whatever they want, but this is an institution based on healthcare management and service. So this is not political. This is everything to do with this country, and this is to do with this hospital. So people can say everything they want to say, but we want to believe that incidents are likely to happen anywhere. It does happen in our homes, it can happen in our institutions, and that's what happened today.
Wow. Madingol Nalben Jubel and Fele Advos Francis Small Teaching Hospital, Loptano to Jam Mialonko Dimba Botanun Jang, Nata Jangiro Kijang. The money may start Mol Malong, Bari, Ning Piero Diamtal, about Fokang Femo Fem sort of the Jang, near Jube Jangmung Loptano to Dinwala Loptano. But alhamdulillah fendi je mi alonko momam faje momam barmaje jamu conference holoti dimbaye jam dula bele tinyajam ne ajube jamu officiality ebi dimani ko master nun jan ana ba so ni when as you can see, this is another cell phone actually that got burned, and then a laptop also. You could see this is also a bed, and you could see the fire outburns here. So they had to break in here in order to get access to the whole place.
There's a loss.
Mboka yéen ñu seetaan fii si Fatou Network live fii si Edward Francis Small Teaching Hospital mooy loptaani xale yi nga xam ne safara daf si génnoon lakka place yu bëri fii nii especially seen conference hall bi ba léegi loptaan lu ñu gën a wax mooy xamuñ lu commencé safara bi waaye NDMA official ñu waxtaanal ñu wax mooy security guard bi dafa toog na mu gis safara si muy génn si benn si mattress bi si éponge bi then from there si leen nii balaa ñu yëg safara bi taal waxtaan ak ñi ni hospital management bi waaye ba léegi ñu ngi work si leen waaw musidɓe so ndaare menen ɗo Banjul ka loptano sukaɓe ɓen ko annduɗa yiite yalti noon nder ga sunni dulaji ɗen fof surti loptano sukaɓe ɓen ko annduɗa ko ɗon ɓe walto so e nder ɗum noon hay goto mayani hen kono
There's prior incident to the pediatric chair at the hospital, but we say that we thank God that there are no casualties here.
So, on a final note, so far so good. From what we find out, there are no casualties, and all the patients that have been in this particular area have been vacated, transferred to another ward. Likely the level of damages here could not still be quantified. Official information from the hospital management is yet to actually reveal the amount of damage that has been made here. So far they said that that investigation over the start or the cause of the fire is ongoing, and as such, we are yet to get that information. And we will bring you live updates as to the cause of the whole fire incident, and then we will see. So follow us. We will get you live updates, everything. The Honorable Minister for Health is Dr. Samate is here.
That occurred sometime this morning, and the team that was around, they came together very quickly, very urgently, to take action using fire extinguishers and so on and so forth. The babies who were on the other side of the ward, this happened, as you must have been aware by now, in the conference room, which is a little distant from the neonatal intensive care unit. However, it's the same building, it's the same floor, and the babies were evacuated to safety, where they continue to receive their treatment, and the team did what they could do before the arrival of the fire service. Fire service teams came from the State House, equally speaking from the headquarters, to help us put out the fire. We are told it was an electrical fault. That's the initial report. But however, we need to be able to get a full report, a full assessment of the situation. So we are all here with the hospital team, and certainly we thank the hospital team remarkably, from the cleaners, that's the orderlies, to the security men, to the nurses, the doctors, the entire team. Everybody was around, and all hands were on deck. And so the patients are all stable and safe. They are on the other wards, and we are moving them to the newly renovated wards. We are just from inspecting that place, those places, and where the children are going to be, where the mothers are equally going to be, where the medical staff are going to be. The places are ready, and they're going to be moved. You can see the government representation. You can see the defense minister. You can see the national security advisor. We're all here to make sure that everything is in order. Thank you.
Well, we saw the commitment from the government, judging based on the numbers of state officials present, accompanying you to this situation. But again, what are the efforts going to be put in place to avert the reoccurrence of such incidents, being it an electric spark?
Thank you very much. Of course, electric sparks, there are various causes of electric sparks. We don't want to preempt the findings. We're going to await the findings. But whatever the causes are, we will do our best to ensure that it doesn't happen again. Of course, you are all aware that this building itself is an old one, very old. It got renovated a number of times, and to make it usable, to make the environment conducive. But that doesn't mean that it's not an old building. So depending on the findings and the recommendations, we're going to act appropriately. But I can preempt that the actions we are going to take will be to deal with the problem once and for all. But what you also need to know that of course, you've seen the renovation in other parts of the hospital. We are just from inspecting there. And it will be good for you to go to those places where the children are going to be now. You'll see that those places are up to task, up to scratch. They are very, very good, in very good conditions. And that's where the children are going to be for now. Now, where the mothers are going to be equally, I'm sure you're going to also see. But importantly, it's important for you to know that we as a government, we are building a brand new neonatal intensive care unit. We are just from inspecting that place. It is near completion, and it's important that you also visit that. That is on top of the labor ward and the maternity theater, so that when babies are born, babies who need the services of the neonatal intensive care unit do not even have to travel, be brought across the road to this facility. They will stay there. There's a lift connecting the ground floor where the labor ward is and where the maternity theater is to that floor. So government is doing quite a lot to improve on this thing. These were all things that facilities that we inherited. We've been doing our best with them. But as a government, we finding very, very long-lasting solutions to all these things we inherited. And I'll be happy if you equally visit those sites.
Of course, it's a political year. And most of the time, people will use this incident to peddle misinformation. What would be your message to such?
Well, I would tell them that for electrical faults, they can happen anywhere. Various reasons are responsible for electrical sparks. I don't want to speculate what caused this one, but really electrical faults can happen in our houses anywhere. But I think what is important that is the steps that we do thereafter. As I mentioned earlier, this is an old building. We we renovated it before so that it becomes habitable. But government is finding, in fact, is actually carrying out long-lasting solutions to all these challenges. Yes, and of course, you mentioned it's a political year, but I think people should know that it's not everything that should be misinterpreted by politicians. I think it's important that when certain things happen, we see them as national issues, and we forge our efforts together. We come together as a nation, rather than trying to make political points out of it. I mean, who would ever want an electrical spark to happen anywhere? Nowhere, especially for such a responsible government that's doing all what we can do to ensure that we build a robust health system for the people of this country under the leadership of His Excellency the President. I have been here. I am on leave, but when I heard about this, I had to rush to come here and be with the team. And then the president is actually in a cabinet meeting now with my cabinet colleagues. And then he has to dispatch the defense minister and the national security advisor to come and join me to show solidarity, not just to show solidarity, to work with the team in the hospital. The chief medical director and myself and his team have been going around for the past few hours, to deal with the issue.
Any message for the victims, those who were actually here? I'm not for sure that they will be in a mode of panic.
Yes, so they would have panicked. Anyone would have panicked under this situation. We all have been very concerned. When I heard about it, I'm on leave, I said. I was running to put on my trousers and I put my belt on the way, running towards the car. And my shoes, I had to run holding them, because we all panic when things happen that could affect the citizens of this country. We are all very, very, very concerned. So, but we have seen them. I have seen each of the mothers. I went round to see them, to talk to them, to encourage them. And they are all upbeat, and we thank the Almighty Allah. All the babies are safe, so we keep on thanking the Almighty Allah. But the message to the mother certainly was encouragement to tell them that this was an electrical fault, as we were told, and government and the team, the hospital team, is doing all what we can do to ensure that the issue is addressed, and they will continue to receive the best of care.
Thank you.
Thank you. You all want to talk to our colleagues? Yes.
This is you too.
Yes. Yeah.
Very
Yes. Thank you.
I'm sure you covered all.
You okay with that?
Yes.
Okay.
You covered all.
No, on the security aspect. On the security aspect. You can just dial. We are live right now.
You are live.
Yes, we are live right now.
On the security aspect, because security is defense and security together.
So hold.
Sorry, I would love them to be up there. So
Okay, that's fine. Allow us to.
There?
Your voice will soar, and then my fuller people will come after you. Well, if you are watching us, is the Honorable Minister for Health and Social Welfare, together with the Minister of Defense and the National Security Advisor, who are actually here to see the level of damages that is actually made here. So, what can you say, Dan? You make a minister be.
But is there any maps there? Yeah. No, it's okay.
Now,
So they came with all their gadgets actually,
yes.
and they were really working hard to ensure that the fire was put out. Yeah. Okay.
So we wanted to, Defense Minister, we wanted to know your first reaction when you actually had the incident, given the fact that you were with the president and this news was actually brought to you.
Yeah, thank you very much. First and foremost, I want to join my colleague and brother to extend a very, very sincere apologies to anyone who might have been traumatized as a result of what happened, whether this is the parents of children, those who came in as escorts, or those who work in the hospital as well. Because when you heard him, he was not speaking only about the patients, he was talking about those who also work here. That we thank Allah that at the end of the day there was no mortality. We thank God for that. We also thank our security forces, in particular here, the Gambia Fire and Rescue Services, for promptly responding. Those who came in as first responders, from them and from the state guards, we understand they also mobilized quickly and came in, joined the staff to actually ensure that this fire was contained very, very quickly and robustly. We thank them for that, for your service to the nation. I do not have a lot to say here in terms of my purview, my role, my remit, but in terms of security for the country, we will ensure that at the level of the Security Council, adequate information is shared. His Excellency the President is already in the know, like you said. He will give the right instructions at the right time to the Council for us to work with the Minister of Health and his team to ensure we work on disaster risk reduction at all levels, particularly in the hospital, to ensure these kind of things are prevented where we can. But like he said, this can happen anywhere at any time. There are so many reasons why this might have happened. But we will wait for the report and we'll support him at the level of council. Whatever can be done, not only by the GPFRS or the fire service, but any other security outfits in the country, defense outfits, to ensure we work with them to provide the necessary environment. This maintenance, this renovation that is going on is preventative. We talked about the age of the building. All these things are important to say that the government is paying attention to that, because we know we need to modernize, we need to change a lot of things. Some of these wires are old. That in itself is a risk. Yeah, so I think that's all I wanted to say. Thank him on behalf of His Excellency the President. I'm sure he'll be keeping his eyes and ears on the ground.
Of course,
on this matter.
many would be, anticipating or will be curious as to how the president would have felt when this news was actually
Of
brought
course,
to
he
him.
is shocked.
And you were there with him.
Every negative incident in this country disturbs the president and concerns him. And he wants to ensure, first, that we are all safe. Safety is priority number one. But where incidents occur, he always ensures that the necessary resources are deployed at the right time to ensure that whatever is our obligation under the Constitution is carried out. So, of course, he was not happy that this happened, but he's happy that we responded appropriately and ensured that there were no mortalities. Okay?
Thank you, sir.
Thank you. Thank you very much.
Well, you've just heard it from the Minister of Defense, Babukar Ismail Ajub, and also from the Minister of Health on women.
So fella is not very good because of the difference. For you also. You have respiratory problem.
So they were actually at the extreme end. So let's see where they were.
This is where they were.
Yeah.
So we are taking you
So the
through.
patients were not here.
Okay.
Yeah, the patients were here. But evacuation is a precaution.
How are you? Well done, all of you. Yes. Yes, you did that. They did very well. They were the team running around and supporting and even evacuation and so on. Yes.
So they were.
So this was the main ward where they were. So the wards are safe, but of course it's the same building, and it could spread, and even the smoke itself. So that's why they had rapid evacuation downstairs. Yes.
Of course, you've not dilated a little bit on the damages that have been encountered here. Are you actually privy to the preliminary findings on the level of damages, and how much would it cost the hospital to take care of this damages?
I think for that we need to wait for the report. Well, you saw where it was. It was confined to the other side, which is adjacent to the conference room, the resource room, where you have some computers and so on. So for that, I will indulge for your patients to to wait for the report, so that we don't.
How too soon are we expecting the report? And what?
Well, the report will have to come from
your partnership or your collaboration with the GF, the Gambia Fire Rescue Service, in trying to making sure that the report is.
The Gambia Fire Rescue Service is an agency of government, and they have been participating in every aspect of the fire prevention and management system of this country, even if it were private entities. So they will do due diligence. They have the capacity. They have the competent people. They had done things like that before to come up with a report of the findings. But you can see already the building has been evacuated safely, and it will remain so until, inshallah, we get the report from them, so that we know where to move on the next step. But fortunately, we have a good place where we have put the patients. Yeah.
So we'd love to talk to the National Security Advisor. Of course, you have a stake in this. Of course, you have a stake in this whole issue. Take us through, as National Security Advisor, what is government's role or step or measures that you are going to take to making sure that you equip the necessary, institution in time to make sure sort of things, because every year we report disasters happening both in government institutions and also in public spaces.
Let me begin by indicating that it's an unfortunate development, and we commiserate with all of the victims, particularly the mothers that are here, but importantly also to commend the team of the hospital who were the first responders, doing so through their honorable minister here, and appreciate the team and collective work that they have exhibited before the competent fire and rescue service arriving on the scene to also complement the initial work that was done. We want to thank God that at least it has not escalated. We have not also recorded or witnessed the loss of life, mortality. So that alone in itself should be a point to appreciate the efforts and what have been done in terms of the immediate response to the fire incident in itself. Now, this is not necessarily a security issue. When we looked at risk assessment, there are two components. And talking about also threats, you have 5 categories. 4 of these threat categories are specifically security related, but 1 is specific as a hazard. And under hazard, this is where you now have safety aspects, whether it's fire disaster, whether it's floods and all. So let's not consider this incident as a security issue. It is purely a safety issue. And I can also assure you that government has done everything as it relates to ensuring that capacity is also built around responding to incidences that are safety related. We want to indicate that at this point, we are unable to tell you specifically what has happened. We can insinuate, but unless the fire and rescue services conduct an assessment after this incident, we will be in a position to confidently and competently indicate what must have been the cause of the fire. Now, when an assessment is also done of such nature, it tends to bring out the causative effects, what must have caused the fire, but then it does not also stop there. They will also come up with findings and recommendations. Now, when we receive this report, based on these findings and the recommendations, we will be able to know what additional mitigation measures that can be put in place to avert such occurrences. But even not waiting for the assessment report to come out, already the Honorable Minister have hinted to the Minister of Defense and myself of the need preempting of conducting some training in terms of the use of extinguishers, in terms of fire drills. So these are all issues that we will ensure once the report is out, they will be implemented as urgently as possible. I would not go to the extent of saying it's a natural phenomenon, but as the Minister has also indicated, accidents and incidents of this nature, such nature, must not be politicized. They are occurrences that can happen at any time, and it's not only immunical in government facilities, neither should it be pegged or leveled on government. Accidents are accidents. Incidents of this nature can happen anywhere, and I think especially where it has occurred, it should galvanize a whole of government and society approach in remonstrating on what has happened and showing solidarity to those who might have been affected, but not being used as a political tool. It will not fly. I think this is all what I wanted to say, but once again, I want to really thank the hospital team through their management, but particularly through the Honorable Minister, for the collective teamwork that has been displayed in terms of the prompt response, and also commended the Fire and Rescue Service.
One more quick question.
For their timely response to the
One more quick question. You made mention of the use of fire extinguishers, and we know that a lot of institutions, both government and private, do not actually know how to use it. Are there any plans to have a sensitization caravan, being on media or outside, to enlighten people more on the use of fire extinguishers?
There is, and it's an ongoing work. I would not indicate that it's not happening. I think we have witnessed of recent radio and television series of public outreach activities being conducted by the Fire and Rescue Service. Probably what we will have to do is to intensify it and have other approaches to it than just probably using the radio and the television. But the caravan may be something that we can think about.
So we proceed. So we've all heard from both the Minister of Health, the Defense Minister, and also the National Security Advisor to the Office of the President on this whole issue. Unfortunately, like we said, or fortunately, there were no mortalities, no injuries actually recorded. But the actual finding, the actual thing is what we are actually waiting for. Unless and until that is done, we cannot ascertain, neither confirm that the fire incident actually started as a result of a fire break. That was all we have for you. Join us as we bring you live updates, and we will also share with the report on the findings from the Gambia Fire and Rescue Service and also from the hospital management as to what actually happened here at the pediatric unit. Therefore, we want to thank you for following us and keep following us. Thank you.